Hey everyone, my name is Ashley. I'm a full-time mom and I take Palsonify for acromegaly. I try so hard to forget a lot of my young adulthood because a lot of it was me feeling terrible every day of my life. The swelling was terrible. It caused pain. I one time had a headache for 9 days straight. My friends would do stuff that I didn't have the energy to do. I went a whole entire year without leaving my house just to make it to the mailbox and back. That was my goal every day. I had a couple breaking points. One of them was I was just having a bad day. I stood on the back porch in the dark and just cried and looked up at the sky and just remember thinking, I'm gonna die today. And I went to the hospital and they said, everything looks fine. It made me feel like I was going crazy. For so long, I was never able to even think about what I wanted to do, what I wanted to be. I just knew I wanted to be a mom. And the day that my son was born, I felt like I wasn't even in the moment. Should have been the happiest day of my life. And I was focused on how I was feeling. It was the biggest sense of relief to hear my doctor say, you have a tumor on your pituitary gland. I was at lunch with my girlfriend. And when I got off the phone with my doctor, my friend was like, how are you not terrified? And I told her there was no fear. It was such a relief to know that it wasn't in my head. After surgery, we started on the injections, which were terrifying. The needle was very large, pain at the injection site, redness at the injection site, headaches, inconsistent symptom control. My heart would race so fast. They really messed up my blood sugar. My doctor mentioned that there was a clinical trial coming up that she thought I might be interested in for a once daily oral medication. And I was hesitant because injections were managing my IGF-1. But then a couple days later, I was like, I'm so tired of this. Maybe I should do the trial. And I said, sign me up. I had a big moment when I realized I was feeling better. Axel, my son, was jumping around in the pool, and I was sitting there actually watching him have fun, and I felt like I was in the moment. And I was like, wow, I'm just watching my son enjoy swimming. Palsonify has helped the most with symptoms. I can sit on the bleachers and watch my son play sports without being in pain. I did experience some stomach-related side effects early on, but they were generally mild for me. Happened in the first couple months of treatment and went away after about 2 or 3 weeks. I have not had any of those terrible injection headaches. I don't know where I would be without my husband or my son. He's at the age where he just loves to do something all the time, and I'm ready to do it with him. When I look back, all those years that I felt bad, how much I missed out. And I feel guilty because all I ever wanted was to be a mom. And I got my son. And then I felt like I wasn't a very good present mom. And I felt like that was unfair to him, even though I did the best. I know what life can be like when I'm in the moment. I know that it can be awesome. I'll never get that time back, but moving forward, I know that we have lots of fun to be had. You have to live every day doing the best you can, hanging out with the people you love, and just soaking in.
What is Palsonify paltusotine? Palsonify is a prescription medicine used to treat adults with acromegaly, for whom surgery was not effective or surgery is not an option. It is not known if Palsonify is safe and effective in children. Important safety information. What should I tell my healthcare provider before taking Palsonify? Before taking Palsonify, tell your healthcare provider about all your medical conditions, including if you have gallbladder problems, have blood sugar control problems, low blood sugar or high blood sugar, have problems with low heart rate, are pregnant or plan to become pregnant, it is not known if Palsonify will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Palsonify passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take Palsonify. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Palsonify may affect the way other medicines work, and other medicines may affect how Palsonify works. Especially tell your healthcare provider if you take any medicines that can slow the heart rate. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of Palsonify? Palsonify may cause serious side effects, including gallbladder problems. Palsonify may cause problems with a gallbladder. Tell your healthcare provider if you have sudden pain in the upper right area of your stomach, abdomen, sudden pain in your right shoulder or between your shoulder blades, yellowing of your skin or the whites of your eyes, or pale stools. Blood sugar problems. Palsonify may change hormone levels, potentially causing either high blood sugar, hyperglycemia, including diabetes, or low blood sugar, hypoglycemia. Tell your healthcare provider if you have problems with high or low blood sugar. Your healthcare provider will check your blood sugar when you start taking Palsonify or when your dose is changed. Heart rate problems. Tell your healthcare provider if your heart is not beating normally. Thyroid problems. Palsonify may keep your thyroid from releasing thyroid hormones, leading to hypothyroidism. Your thyroid function may be checked periodically during your treatment with Palsonify. Fatty stools. Palsonify may cause your body to have problems with absorbing dietary fats. Tell your healthcare provider if you have any new or worsening symptoms, including fatty stools, changes in the color of your stools, loose stools, stomach, abdominal bloating, or weight loss. Low vitamin B12 levels in your blood. Your healthcare provider may check your vitamin B12 levels during treatment with Palsonify. The most common side effects of Palsonify include diarrhea, pain in your stomach, abdominal area, nausea and vomiting, decreased appetite, slow heart rate, bradycardia, high blood sugar levels, hyperglycemia, and irregular heartbeat, palpitations. These are not all the possible side effects of Palsonify. For more information, ask your healthcare provider or pharmacist. You are encouraged to report negative side effects to Crinetics Pharmaceuticals at 1-833-CRN-INFO, 1-833-276-4636, or FDA at 1-800-FDA-1088, or www.fda.gov/MedWatch. Please see full prescribing information, including patient information, at palsonify.com and talk to your doctor.